In the last 2 lectures, we briefly discussed the 12 transformational practices, and we outlined the 6 essential elements that permit transformation to happen in medical organizations. Today, we're going to dive into the first of those transformational practices, scheduling patient appointments. This lecture is going to focus on an innovation in scheduling called open access scheduling. It allows physicians to treat today's problems today and preempts sending patients to emergency rooms or urgent care facilities. But it requires a significant change in how a physician office works. In open access scheduling, some percentage of a physician or a nurse practitioner's appointments every day are left unscheduled. There's no patient listed, and patients will be slotted in when they call and need to be seen. Experts differ on how much of the physician's slots should be left open. Some recommend 20%, others as many as 70% of the slots should be unscheduled. Just to give you an example, on a Monday morning at 8 a.m., the physician's schedule might show that only half of the slots have a physician assigned to them, and half of them, there's no patient listed. They're available for patients who got sick over the weekend or are feeling bad in the morning to come in at that day. Open access scheduling is often a big change from how clinics typically have scheduled appointments. Most physicians are nervous that patients won't show up if they're not scheduled. So they hesitate to leave appointments blank, fearing that if patients don't call or don't need appointments, they'll have a loss of revenue. This means to truly put in place open access scheduling, we have to seize control of the schedule appointments from physicians and the front office staff. In open access scheduling, a patient calls, they're given the opportunity to see their own personal physician at an available slot that happens to be open that day. If there's not a slot open that day, they can be given a slot for the next day. If the appointment is time sensitive, if they have a problem that needs to be addressed today, they can get an open slot for a colleague of that physician. The next appointment would say a nurse practitioner or another physician who can see the medical record and address their particular problems. There are many benefits to open access scheduling. First, patients are seen the same day that they have a problem. If you're seen the same day you make an appointment, you're much more likely to show up. One of the real problems for any physician practice is that a large percentage of patients have made an appointment, something intervenes, or they forget about the appointment and they don't show. These no-shows actually do cause a lot of lost revenue. On the other hand, if you call at 10 a.m. and the front office staff says, the doctor can see you at 2 p.m., you're very unlikely to miss that appointment. A second advantage is there's no double booking of patients to accommodate that patient who needed urgent care. So the patient whose slot was scheduled doesn't get shortchanged, and the patient who has an urgent problem that needs to be seen also doesn't get shortchanged, both being seen in a 20-minute slot. Instead, there is an open slot where the patient with the urgent problem can actually be seen for a full appointment. Another benefit of open access scheduling is that patients tend to be happier. They get real same-day service in the healthcare system. Patients have become used to same-day service from Amazon and others, and now in the healthcare system, they can call up and be seen just a few hours later. Ironically, physicians and front office staff are also happier because when a patient calls with an urgent problem, it's nicer to say, we can see you in a few hours. In addition, physicians don't have to feel like they're being rushed and double booked constantly, and they can take the time addressing patients' problems. Final advantage of open access scheduling is that it can lower costs. You can see a patient who has an urgent problem in the office rather than sending them to an emergency room or an urgent care facility where costs are higher. There's a good example of this in an oncology group in the Philadelphia area, where part of a larger change to better manage patients with side effects from chemotherapy, they instituted open access scheduling. So when a patient had a serious side effect from chemotherapy, say uncontrolled nausea and vomiting or diarrhea, they could be seen in the physician office at one of these open slots rather than being sent to the emergency room. As a consequence, that oncology group saw a greater than 50% decline in its emergency room visits in 6 years since adopting open access scheduling and the other changes. But we should be blunt. There are some serious barriers to implementing centralized open access scheduling. The first and probably most important one is physician autonomy and control. Physicians look upon the scheduling book as the holy grail of autonomy. It organizes their time, and to give up the scheduling book or to have it blank means that physicians lose control of their schedules. They don't like it. A second issue is that physicians fear they'll lose revenue. If half the appointments are blank, they worry that they won't see enough patients to have sufficient revenue flow. I know that my father, who was a pediatrician, would much rather have seen many more double book patients than have blank slots on his schedule, even though they might be filled, worrying that he wouldn't see enough patients to actually have enough revenue to keep the office going. So in conclusion, open access scheduling allows medical organizations to deliver care faster and more efficiently to their patients. They see patients who have problems today in their office where they know them, they know their medical history, rather than sending them to an urgent care facility or seeing them next week when the problem might have been resolved. In our next session, we're going to hear from Simeon Schwartz, the former CEO of WestMed, a 360 physician group in Westchester County, New York, about how his organization implemented open access scheduling and the challenges they faced to make it successful.